Correct blood pressure measurement technique. This illustrative demonstration shows the correct technique for measuring blood pressure in an adult patient using the auscultatory method. In this example, Mrs. Latha, a 55-year-old school teacher, attends a health camp for a general checkup. Her blood pressure is found to be elevated, and this scenario is used to demonstrate the correct steps of blood pressure measurement. The learning objective is to demonstrate proper patient positioning, correct cuff size selection, appropriate cuff application, and accurate auscultatory technique. The first step is to explain the procedure to the patient and allow adequate rest before measurement. The patient should be reassured and asked to sit quietly for at least 5 minutes. This is important because recent physical activity, anxiety, or talking can temporarily increase blood pressure and result in an inaccurate reading. Next, the patient should be positioned correctly. She should sit comfortably with the back supported, feet flat on the floor, and legs uncrossed. The arm used for measurement should be bare, relaxed, and supported at heart level. Incorrect posture, such as crossed legs, unsupported back, or an arm hanging below heart level, can affect the reading and must be avoided. The next step is to select the correct cuff size. The mid-upper arm circumference should be assessed, and a cuff of appropriate size should be chosen. A cuff that is too small may produce a falsely high reading, while a cuff that is too large may produce a falsely low reading. Therefore, proper cuff size selection is essential for accurate blood pressure measurement. Once the appropriate cuff has been selected, it should be applied correctly. The cuff is wrapped snugly around the bare upper arm, approximately 2 to 3 centimeters above the elbow crease. The cuff should never be placed over clothing because this can interfere with accuracy. It should fit evenly around the arm and be secure, but not excessively tight. The brachial artery is then located in the antecubital fossa. The stethoscope is placed gently over the brachial artery, just below the lower edge of the cuff. Care must be taken not to place the stethoscope under the cuff. Proper placement helps the examiner hear the Korotkoff sounds clearly during deflation. The cuff is then inflated to about 20 to 30 millimeters of mercury above the expected systolic pressure. After inflation, the valve is released slowly so that the pressure falls at a rate of about 2 to 3 millimeters of mercury per second. As the pressure decreases, the examiner listens carefully for the Korotkoff sounds. The appearance of the first clear tapping sound indicates the systolic blood pressure. The point at which the sounds disappear indicates the diastolic blood pressure. The blood pressure should then be read and recorded accurately. In this example, Mrs. Latha's blood pressure is recorded as 158/96 millimeters of mercury. The reading should be documented clearly, along with the date, time, and relevant clinical setting. If the blood pressure reading is elevated, it should be repeated after 1 to 2 minutes. When more than one reading is taken, the average should be used for interpretation. Repeated measurements help reduce random error and improve reliability. After measurement, the patient should be counseled appropriately. Mrs. Latha should be informed that her blood pressure is elevated and that further evaluation is required. She should be advised about lifestyle modification, including reduced salt intake, a balanced diet, regular physical activity, weight control, stress reduction, and regular follow-up. In a real clinical setting, additional blood pressure readings on separate occasions may be needed before confirming the diagnosis of hypertension, unless there is a hypertensive emergency or other urgent clinical concern. To summarize, accurate blood pressure measurement requires proper patient preparation, correct positioning, appropriate cuff size selection, correct cuff placement, careful use of the stethoscope, slow controlled deflation, and accurate interpretation of systolic and diastolic readings. Following these steps helps reduce measurement error and supports better clinical decision-making.